I'm Tony Jolly. I'm a pediatrician. I've seen a lot of kids over the years that I say are not neurotypical, kids who have ADHD or kids who are autistic, kids who are anxious, kids who have gotten sad, kids who have cerebral palsy. I don't know if it's by specialty, but I've definitely spent a lot of time on that. Kids who have migraines. I sort of tend to gravitate to something that I have to figure out and try to help people through rather than necessarily just going fast. I have a pretty diverse background, and so I think I can relate to a lot of people. My dad's from Jamaica. My mom is a Mennonite. My wife is Filipino and Chinese. I spent 13 years in Chula Vista speaking Spanish. When I was younger, I spoke a lot of Chinese. I've been a banker. I've been a doctor. So I sort of think that I can relate to people from different walks of life with relative ease. You need somebody who is looking at your whole physical and mental health longitudinally and making sure that everything is going in the right direction and that we have a plan. All of us have medical problems, whether they're very minor or whether they're very great. And it's good to have a quarterback for that care. It's not the easiest thing to do for yourself or your kids. You have everything else that's going on in your life, and it's hard to be objective with those things that you need to do. So I think having a primary doctor is important for that reason. That's what we do. I'd say the most satisfying part of being a pediatrician is watching families and kids grow over time, seeing the path that they take, sometimes seeing them get well if they've had an illness, going with them through a difficult time, but kind of being with that family over time, I think is the best part.